In this video, we're going to go through what questions to ask during a patient encounter. We're going to simplify and organize questions to ask, do this without rote learning a list of questions, and ask questions intuitively using natural curiosity rather than a script or a list. Our goals in doing this are to make a more natural flowing interview, increase confidence, decrease cognitive load, and increase interview efficiency. These are the chief complaints we'll be looking at. When going through what questions we should ask, we're going to be using the H In HPI tool. This tool has many benefits over the mnemonics students usually use, including it's much easier and quicker to learn. It's also a holistic approach that you can use much more extensively through your studies. To learn how to use this tool, make sure you check out the previous video before moving on. We start with a modified timeline, and here's an example of our general template. We add our pertinent positives and negatives, and this is the rest of the history. And of course, we can make this much more complex as the chief complaint becomes more complex. This is an example of notes we took using the H In HPI tool. Check this video out to see an example of that. Alright, back to our general template. Now let's look at abdominal pain. What questions would you like to ask? Were these the questions you were thinking of? I want you to pay particular attention to these categories. These categories aren't going to change much, and even when they do, it's very intuitive on what questions you want to ask. We simplified this process quite a bit. And then we have these categories: location, character, and description. They will change quite a bit. And as you learn more illness scripts, or your knowledge of chief complaints expands, so will the questions. Fever template. Were these the questions you were thinking of? Chest pain template. Were these the questions you were thinking of? Again, are you paying attention to these categories? They don't change much, and even when they do, for example, severity, is pretty intuitive. Alright, let's move on. Diarrhea template. For this template, I want you to take a look at location. Think about what questions can we ask that will help us understand more about this chief complaint. Is this what you were thinking of? And of course, the rest of the questions. Headache template. Were these the questions you were thinking of? Shortness of breath. Were these the questions you were thinking of? And a reminder, this is basic. This is not an exhaustive list. Feel free to add to these questions. Back pain. Were these the questions you were thinking of? We just demonstrated using the H In HPI tool can significantly simplify how you go about asking questions. No longer do you have to have a huge list of questions to memorize. The tool will allow you to practice the habit of asking the right questions. Of course, this video is just basic and we're focusing on the HPI. In future videos, we'll go through the entire history.